Pilot.
Change. And let video. Shall we? Oh, okay. Good evening, everybody, and welcome again this evening of today's the 19th, 19th of February 2021. It's a lovely evening where we are. It's very, very warm. So we are kind of sweating. So welcome anyway. Like I said, we are talking from the platform of She Chooses to Live Initiative. Keep stressing that that platform is an organization that wants to give knowledge to everybody, male, female, child, adult, so that people can make educated choices in their lives, especially lives matters reproductive health. So, welcome. My name is Dr. Jane Wakahe. I'm a practicing obstetrician gynecologist. And my tech guy is here. She's called Marion Wakahe also. Well, I mean, not also. She's called Marion Wakahe. And she's my tech guy who helps me to be on Facebook. Last week, we talked quite a bit about urinary tract infection because a lot of people are bothered by it. And it's such a serious problem that I thought we should talk about it properly, so that people understand and people don't delay looking for help, because it can really, really be very damaging. So last week we talked about the first part where we talked about what the anatomy of the urinary tract, what the urinary tract actually does, and who was at risk of getting infections of the urinary tract. And we confirmed mainly that one of the main reasons to get urinary tract infection is just being a woman, the anatomy of a woman. So today we will continue with the same topic. We'll now discuss how you know that you have urinary tract infection, what makes you suspect that you have urinary tract infection, and what really should make you go to the doctor. I want to say from the onset that urinary tract infection is a serious problem. It can cause a lot of damage to you in the long run. So if you suspect you have urinary tract infection, you'd rather go to the doctor and be told there is no infection than wait and see what happens and get late about it. So let's talk about the signs and the symptoms of how you know, how you suspect you have urinary tract infection. I'm going to divide it into two because it has urinary tract infection symptoms and signs are very different depending on what part of the urinary tract infection is being affected. So there are two parts. There is what we call the lower urinary tract, and that involves the bladder and the urethra. And then there is the upper tract system, which includes the ureter, the pipe that brings urine from the kidney all the way to be stored in the bladder and the kidney itself. So when it is in the upper tract area, it is a bit different from when it is in the lower tract infection. I want all of us to really, really be keen about the lower tract infection because that's where it is cured and where it is easily managed. You don't want to get to the upper tract infection, which is a follow-up of usually ascending, comes from the lower tract infection and goes to the upper tract infection. So what are the signs that one has when they have urinary tract infection? One of them, the earliest, is the urge to urinate. You feel you must urinate. Now, when you feel that, one keeps frequently going to the toilet, and when they go, they don't pass a lot of urine. In fact, they pass very little urine, and they feel a bit of discomfort, a bit of burning as they are passing the urine, and sometimes at the end of passing the urine. And when they have passed the urine, they feel like it did not quite finish. So there's the urge to pass, you keep going to pass little urine, and even when you pass that little, you want to run to the toilet again in a little while because the feeling is still there that the urine did not finish. Then there is burning, really burning sensation, a burning that you cannot ignore. Sometimes it's throughout the urination, but much of the time is at the very end where you are so burning and you're saying, like you are trying to push a bit more and to remove the burning. Then the urine that one passes when they have an infection is usually really very bad smelling. So urine smells bad normally, but this one is really, really bad smelling, very foul smelling, so that you can tell it's not a normal urine. Then if you look at the urine itself, it is cloudy, like it has, sometimes it has some like particles inside it. So it's not clear urine. And then one feels pressure at the pelvis, at the lower abdomen. One feels a lot of discomfort and a lot of pressure. Like I told you the last time, that's where the bladder is situated. It's situated just behind the pubic bone. So one feels a lot of discomfort and quite a bit of pressure down there. Now, the one other thing that tells you that you are likely to be having urinary tract infection is passing blood in urine. So sometimes they will pass very little, frequent little blood urine. When there is blood in urine, it could mean two things. It could mean it's really very, very severe, or it could mean that the bacteria that is affecting one is so aggressive that is making the bladder bleed. So it could still be the lower urinary tract area that is affected, even when there is a bit of blood. But if any of these signs happen, you feel you want to pass urine, you keep waking up to go and pass, and it's little. In fact, a lot of people want to avoid taking water because the idea of passing urine is not pleasant to them, because it is very, very uncomfortable. So if that is happening, please see the doctor. At this point, things are still okay. Things are still where it is manageable. The infection is there, but it is still possible to manage it and cure it completely without any leaving behind any long-term effects in your system. So see a doctor if you have any of these signs, any one of them or two or all of them. Kindly see a doctor. But even as you are waiting to see the doctor, you are not going to wait a day or two, but the few hours you're waiting to see the doctor, please take water. Take a lot of water. Because what happens is that if there's an infection somewhere in the bladder and you take water, it flushes the bacteria out. You take water, you urinate, and it flushes the bacteria out. So you want to keep taking a lot of water. It is not pleasant to take water when you have urinary tract infection, because you do not want to urinate, because it's painful. But please take water. But kindly consult a doctor. If left untreated for a length of time, this lower tract urinary infection will go upwards, and will go from the bladder. In fact, it's a very cheating effect, in the sense that when it's a bit stayed and the bladder is used to it, you might think it's a bit better because the pressure in the lower abdomen is a bit less. But what is happening is it is ascending through the ureter and going to the kidney, and it could damage your kidney. So please do not ignore that it is going to go away. One thing about urinary tract infection, if it is urinary tract infection, it will not go away without treatment. So please see your doctor. Now, if it happens that it ascends to the upper urinary tract infection, these are they are now added symptoms to it. This is a much more serious disease than urinary tract infection. So what, I need some water. I forgot my water. Let me pick it. Water. I'm so sorry, I went dry. I usually take a lot of water. So if it is that the infection ascends into the ureters and into the kidneys, now this becomes a serious problem, a very, very serious problem indeed, and you become quite sick. Now, what do you feel when it has ascended? You will feel the same symptoms you were feeling when it was in a lower tract infection, in the sense that you will feel the urge to urinate, you will feel pain as you urinate, you feel the frequency to urinate, you will feel all those things. But on top of that, if it is in the upper tract system, you will have very high fever, very, very high temperature. In fact, maybe more than what COVID is giving, very high temperature indeed. The other thing that you will feel is you'll feel shaking and chills. The way if you've ever seen somebody with malaria, the way they shake and chill, that's the kind of feeling one has. So one is hot, one is feeling shaking and chills. Then there is pain at the back where the kidneys are located. I told you last week that the kidneys are located just below the lower rib, both sides of the back. So there is pain there, quite a bit of pain. Then this is usually accompanied by nausea, a lot of nausea. You want to throw up all the time. You cannot eat, you want to throw up. And there is also, in fact, vomiting, quite a bit of vomiting when one has upper urinary tract infection. There is reduction in urine. The kidneys are what filter the urine out. And if they are sick, they cannot filter blood to give out urine. So the amount of urine is very little, reduced in fact. And when alongside with that, it is very bloody. So you have little bloody urine, which is a very serious finding when you have urinary tract infection. Now, like I keep emphasizing, this is a serious infection. You don't want it to get to this point, and you want to have seen your doctor when the urinary tract infection was still in the lower tract, not when it has gone up to the upper tract. Now, what are the investigations that will confirm that one has actually got urinary tract infection? It could be things, the blood in urine could be things we call schistosomiasis, the bilharzia. It could be other things also. It could be even that it is some cancer of the urinary tract system. So it's not always that when you have blood, the urine is just infection. So there are some things that we'll do that will confirm that it's truly indeed an infection of the urine. And the main one is that we will take some urine. Now, what do we do with this urine? This urine is taken for something we call urinalysis. So it is checked for blood, it's checked for protein, it's checked for sugar, it's checked for many things. And then it is looked at under a microscope to see what kind of things it is carrying with it. So that is urinalysis and microscopy. But the main thing, and this I will want you to carry home and to remember, is that urine, if it is suspected to have urinary tract infection, it must be cultured. So the culture means that the urine is some material that grows bacteria. The urine is put into some material that grows bacteria, and the bacteria, if there is, grows. It is identified what kind of bacteria it is. So it is to do two things. One is to identify what bacteria is actually doing the infection. And the second thing about culture, we call it culture sensitivity, is that we get to know what drugs, what medicines. The bacteria is then tested as to what medicines it is sensitive to, it can be killed easily completely by. So then you get to be given the proper medicine for the treatment of the particular bacteria. So it is important that, especially if you are saying UTI more than once, it is important that culture is done, because without culture you can't really swear that it is really urinary tract infection. It could be just that you didn't take enough water. It could be some trauma down there that is causing some blood. It could be the onset of periods. It could be many things, but the culture is the one that clearly determines that there is a bacterial infection, which bacteria it is, and what is the treatment for it. Because then there are the medicines are graded according to which one will kill it most, because the intention is to completely clear completely clear the bacteria from your system. So some bacteria will be resistant to some antibiotics. Some bacteria will be half resistant. Some bacteria will be very sensitive to be killed by some antibiotics. So the doctor will give you in a proper way which medicine it is that will clear the bacteria. Now let's talk about how to get this specimen of urine, because it's very, very important in a woman that you give the proper type of urine. If we said again that the urethra, the outlet of the urinary tract system, is hoarded somewhere very near the vagina, very near the anal opening. And for that reason, any urine that goes around the vulva, around the vagina, will have material that is from the vagina or from the anal region. So for a woman to give what is called a clean specimen of urine, that can be truly declared that the bacteria we find there are bacteria from the urine, then what a woman does is when you go to the toilet, you pass urine, and when you go to the lab, you're given a bottle to go and put urine for them to go and check what it is. So when you go to the toilet, please pass quite a bit of urine into the toilet. Then when the stream is running straight, you put the bottle and draw some of the urine and remove it before the last lot of urine is coming out, so that the very first urine that goes out cleans the vulva, and you don't want to put that in the bottle. And the last urine also, because it's not a stream, will also flow through the vulva and the anal region, and you get contamination from those areas. In fact, if you do that, we get what is called a mixed growth, because there are many kinds of bacteria that live around that region that are not even infective. They are part of the system. They are what we call commensal. They live with us, but they will grow. Once they are put there, they will grow. So if you do not give the proper specimen, then you get what is called a mixed growth specimen, which now gives you no answer as to what it is that the bacteria that is infecting one is. Now, if that culture takes about 3 days to have the report, because to grow the bacteria and to check what it is sensitive to takes at least 3 days. So if you go to the hospital and sometimes this will happen. Sometimes the doctor will decide that the infection you are carrying is so heavy that they will start you straight on medicine, and that is allowed. But even as they start you on medicine, they will have taken a culture, so that in about 3 or so days' time, when the report of the culture is out, then if the medicine you are being given is okay, then you continue with it. If the medicine that you are being given preliminarily is the bacteria is resistant to it, then you are given the one that is being scientifically shown to to be able to kill the bacteria, and hence you'll be able to clear the infection. Now, if this is not done, if you keep half treating the infection of urinary tract infection, then two things will happen. One, it will not go, so it will become recurrent. So every other time it will suppress and then come up again. It will suppress and then come up again. So it will become recurrent infection. And the second thing that will happen is that the bacteria will become resistant to the medicine, because you are giving them a bit and not completely killing them. So the next time you give them that medicine, they'll not even be effective. And we have that problem with resistance to antibiotics. Sometimes there is nothing you can use to treat somebody except maybe medicine, very, very powerful medicines that are being given in ICU. And a word of caution here to us Kenyans, because I know we like to go off the counter and buy all kinds of medicines, including antibiotics. That is not good. It is making our bacteria resistant to the antibiotic. So kindly do not just take antibiotic obvio. They'll be not good in the long run. So that's what will happen if you do not quite treat the bacteria properly. It will become recurrent. Every other time it will come up, and it will become resistant to medicines, so that at the end of it, you have nothing to treat with. I've belabored the urine because that's the main thing, that the main infection that must be done. And the bacteria must be identified. Sometimes there is no bacteria, so there is no need to treat. You just take a lot of water and make your urine less acidic, and it will stop paining. But if there is bacteria, then it gets treated. Now, the other investigations that we shall do is what is called a full blood count. A full blood count tells you many things. Not only does it tell you how much blood you actually own and how much oxygen you are able to carry around, but it also tells you it's able to declare whether you are fighting an infection, and whether you are fighting a very, very strong infection indeed, whether you are fighting a current infection, whether you are fighting an infection that is ongoing. Times it's even able to guide us that it's not even a bacterial infection, it's a viral infection. So we do what is called a full blood count, and with that we are able to see quite a bit of things. Then we also do what is called, especially when it is the urinary tract infection has hit the upper tract where the ureters and the kidneys are, then we also do what is called urea electrolytes. This helps us gauge whether the kidneys, how the kidneys are working, and if they are not working very, very well. In some cases, again, especially when it is in the upper tract, when there is a very, very big disease, very strong disease indeed, then we do what is called a blood culture, because sometimes infections of the kidney will spill into the bloodstream and get what is called septicemia, that is infection throughout the blood, and this is a very, very serious infection indeed. So we will sometimes go to the point of doing a blood culture. But the mainstay is urine checkup, and that's usually when it is the lower tract. That's really sometimes all that we do. Get the bacteria, clear it, and then things go on. But if there is fever, if there is chills, if there is blood urine, then we do all the others. Now, the other thing we will occasionally do is an ultrasound. We will ultrasound, we will scan the kidneys to see how they are. We will scan the ureters to see how they are. Sometimes, like I said, one of the causes of frequent infection is things like kidney stones. So those will be able to see whether there are any kidney stones. So we'll do sometimes an ultrasound. Sometimes we even just do, as we do the ultrasound, the bladder is shown that it has had very what is called chronic cystitis, which means that it has had urinary tract infection over and over again until the wall of the bladder is actually deformed a little bit. And that tells one to be very, very alert about urinary tract infection. The other thing we can do is something we call IVP or IVU. That is something that we put some dye that is picked up by X-ray. And this one is mainly when the disease is quite big and we are trying to check whether the kidneys are okay or not. In some cases, a surgeon will do what is called a cystoscopy. Cystoscopy means that one puts a camera through the urethra right into the bladder and visually checks the bladder and checks how it is. This sometimes is if we have blood urine and we are not being able to grow any bacteria, so we are not even sure that it is a bacterial infection. Then one puts a cystoscope, and looks and decides whether maybe there is something that is causing, there is a wound there in the bladder, which may be innocent or which may be cancer that is causing the bleeding in the blood, in the urine. So that is another one. And finally, very later on, we can do what is called MRI and CT scan. And this again is to see the kind of damage that may have happened especially to the kidneys and to the ureters indeed. Sometimes you do and you find that there is a backflow of urine into the kidney that is actually damaging the kidney, and you have to deal with it. Now, how do we prevent ourselves from getting urinary tract infection? And believe you me, one of the best ways is to drink water, and a lot of water, because even as the infection is trying to get hold into the bladder, if you keep flushing it out, then it would be a very, very serious infection. But that the water itself is not the solution. But drinking a lot of water will remove the little ones that may have ascended towards the bladder. The other way is for women and girls. Again, I emphasize that the urethra is located somewhere between the vagina and the clitoris. It's in that region. If a girl or a woman wipes themselves when they have had a bowel motion, when they have passed stool, and they wipe themselves from the front, how shall I describe it? The way to wipe oneself is to start from the front and go backwards. Start in between, go backwards. But if one goes forwards, then they are likely to introduce the E. coli that I told you causes the 90% of all the infections. They are likely to introduce the E. coli into the opening of the urethra, and they are likely to get urinary tract infection. So mothers, instruct your girls to wipe themselves back forwards, and when you have daughters, please start wiping them back forward. Oh, what am I saying? To the back, going to the back. You wipe with one tissue, you throw it away. Do not repeat it again. You take another one and you wipe forward, backwards, going backwards, so that you never bring anything forwards to the urethra. Now, the other thing is to not keep urine for long. If you keep urine for long, the two things happen. One, the flow from the kidney is not so very good because it's finding a full bladder. And two, the urine stasis. It's like static water. If there is even one or two bacteria that were hanging around there, now they will grow and they'll make for urine infection. So pass urine, the minute you feel you have urine, pass urine. I know there are times you can't pass urine because you are obvio. I mean, you are in a place where you can't, and that's why I teach us about Kegels. But Kegels is only to be used when it is totally impossible to pass urine. When it is possible, kindly you feel urine, you go pass urine. Don't keep it. Now, what are the complications of untreated urinary tract infection? I said before, if it is urinary tract infection, it will not go away on its own. It will only go away when it is treated, and it needs treatment. Now, if it is not treated, or if it is only partially treated, so that you take antibiotics and day 2 you feel it better, which you will, by the way. You will feel as soon as you actually start antibiotics, by day 3 you will feel better. But that doesn't mean you're well. So if you do like that, then what will happen to you? Now, there will be recurrent infection. I believe at that point that there'll be recurrent, either from the bacteria that were never quite finished, and the recurrent comes with quite a bit of damage. So there'll be recurrent infection. Recurrent infection, I'll mention it at the end, but in case I forget to mention it, recurrent infection can also be from not just that it wasn't treated, but from reinfection each time. And some of the reasons why there would be reinfection is, like I said, wiping coming forward. So each time one infects themselves, even though they have been treated. Sometimes during menses, then the bacteria have a habit of, there is a bridge between the anus and the front of the body and where the urethra is, so that sometimes the bacteria, the E. coli from the anal region will find a place. So, and will find a way to get into the urethra, and especially because there is a lot of blood to feed on the way. So the main thing is, again, do not keep pads for too long. Do not keep them long enough so that the bacteria manage to crawl along and go to the urethra. So keep pads the very minimum possible. Even if it's not full, kindly do not keep it for more than about 4 hours. Just throw it away. The only time maybe you can keep a pad overnight is overnight, but make sure you are really, really clean and that area is not got E. coli to bring to the front. So recurrent infection can either be that it didn't get quite treated, so it's the same bacteria becoming more resistant, or it can be that there is an infection all over again. Now, what is the next thing that happens? And what you don't want to happen to you is kidney damage. You don't want renal damage to happen, because renal damage, if it happens, then you'll have to keep undergoing dialysis. The body cannot, the kidneys are used to filter all the poisons in the body and set them out through urine. So if your kidneys have been damaged by infection or by anything else, including trauma, if they've been damaged, then you will need your blood to be filtered another way artificially, and that is dialysis, which is, of course, not a very, it's not natural, it's expensive, you don't want, and you had your kidneys, which will be doing the same job. So don't get them damaged. The other thing will happen when your kidneys get damaged is that your blood pressure will go up. We talked about how it is that kidneys also help to control blood pressure. If they are sick, then your blood pressure will go up. And this, even if it is only one kidney which is sick, your blood pressure will go up. So that is, again, you want to avoid blood pressure. You don't damage your kidneys. The other thing is that I again told you in the functions of what the kidneys do, what the urinary tract do is that they help with building blood. They make a hormone called erythropoietin, which helps to make blood. So if that is not happening, then one will get anemia. And finally, one will be a sickly person with lowered immunity, which means that any disease that is around the wind will catch you. Is called a comorbidity. Now you will have a comorbidity of sick kidneys. And finally, you may even need a kidney transplant, or because the urinary tract infection was not treated in time. Now, men can get what is called a urethral stricture because of urinary tract infection, and they'll have difficulties both in passing urine and in ejaculating. Like I told you last week, the urethra of the man has the two jobs. One is to void urine, and the other one is to ejaculate semen, and so they'll have trouble with that. If a woman is pregnant and she keeps getting UTIs, then she has some dangers lurking around there. She is likely actually to get a premature delivery just because of urinary tract infection. In fact, if a pregnant woman comes and says they are cramping, the first thing we check for is there a bladder infection, because that is going to cause her to go into premature labor and deliver a premature baby. And then there can be, like I said, very, very severe infection into the bloodstream. And if that happens, then one is looking at actually very likely death. And even if that doesn't happen and the kidneys are damaged, one is looking at very low quality of life as compared to what they would have had if they had taken care of their urinary tract area. Now, what is the treatment of, we talked about prevention. What is the treatment? If one actually does get urinary tract infection, what is the treatment? The first thing I want to say is that again, I can't emphasize this enough. If you're being treated for urinary tract infection, please finish your medication. It is not pleasant to take medicine. It is very unpleasant to not take medicine. The consequences are not very nice. So take your medicines. Now, the treatment, I usually don't talk about treatment on this forum, but I'll say this, that the treatment depends on where the infection is at. If it is at the lower tract area, the bladder, the urethra, it is possible to even just give antibiotics by mouth for a prolonged period of time, and then it is possible to cure it if it is at the lower tract. If it is at the upper tract area, it will take a much longer time. Most likely there will be admission into hospital, and most likely you will not take things by mouth. You are already really vomiting anyway, so you'll be given medicine either through the vein or through the muscle or whatever route it is, and it will be for a long, long time. So do not let it get to where it gets to the upper tract infection. Report to your doctor. As to what medicine should be used, like I said, we culture and we decide what medicine it is that you need to use. So let's recap a few things especially for the woman audience. We talked about midstream specimen urine. I hope we will remember that each time we go to pass urine for investigation, we'll give the stream that is running chua, not the first lot of urine and not the last lot of urine, because those have many things that have carried from the vulva, from the vagina, and even from region. Now, recap 2. Please do not ignore signs and symptoms of urinary tract infection. It is better you go and you are told it is not it. That is, maybe you are just having a lot of acidity in the urine, and maybe that's what was causing the problem. But it's better that way than to wait and get yourself infected. So do not ignore. And finally, do not treat yourself midway. Whatever amount of medicine you are given, please finish that medicine. And then in about a month's time, when all is well and everything is fine and you're not feeling any problem, then you go back in a month's time and you give out a specimen of urine, and it's checked that it's actually cleared. So you are cleared of that particular infection. If another one comes, it will be a different one, not that particular one. Now, there is something that mimics urinary tract infection that I want to give a pointer to, and this is called the Honeymooners Disease. When ladies get married and they are on their honeymoon, they're having a lot of sexual intercourse, very much. And what the penis does literally is it traumatizes the bladder as it is doing its thing in the vagina. It traumatizes the bladder, and the bladder gets very, very sensitive indeed. And people actually feel all the signs of UTI. They feel they want to pass urine very, very frequently. Sometimes there is even a little bit of blood, and when we culture, there is nothing, and that is called the honeymooners disease. It's just from trauma. So how to go around it is two things. One, make sure that your bladder is empty before you start having sex, and two, make sure you drink a lot of water, so much so that you have emptied your bladder before you have sex. When you finish having sex, you've taken so much water, you already have another urine. So in a little while, you go and pass the urine so that anything that also was introduced by the non-seeing penis will be flushed out. So that's the way to go around honeymooners disease. It's a disease that is from a good source, so that's not quite a bacterial infection. But newly married women will experience that, or they will experience frequency of urination. They'll experience a bit of pain in the lower abdomen, and they'll experience sometimes even a bit of blood in the urine, but that can be accounted for by the trauma. It's the what causes the frequency in infection is basically the same as what causes the trauma, because it's the damage of the bladder wall that makes somebody feel they want to pass urine many times. But this is damaged by bacteria, and the other one is damaged by trauma. So that's the one. Now, what is not UTI? Because why I even took up this topic is the many women who come to the clinic and tell me, I'm always getting UTI, I'm always getting UTI. Now, UTI is not a vaginal discharge. It's not a discharge that looks like maziwalala. It's not a feeling of wanting to scratch oneself. It's not a feeling of soreness at the vulva. That is not UTI. That is usually a yeast infection, and it's just that the two areas are very interconnected, but yeast infection and UTI are not the same thing. Now, I think somebody asked about the frequency, the recurrent infections. I hope that has covered it. The treatment, again, I can't overemphasize, please finish your treatment. Otherwise, you are going to end up either in dialysis, high blood pressure, and all kinds of things, including kidney transplant, which is not a very good something. Now, I think I've talked very much. I'm even dry in the throat. I will accept any questions now, and I'll have the tech guy back. Somebody here says they have never heard of the honeymoon thing. Yeah, it's called Honeymooners Disease. Where is Wamoyo today? I'm not seeing her. Wamoyo is it? She's from Britain.
Okay, tell her to come back.
Yeah, I saw her last week. There doesn't seem to be any questions. Mhm. That is it. I think.
I was expecting many questions.
I hope they understood. The main thing is to go to hospital. Report. Oh, kegels.
What a kegel.
Do I recommend using kegel balls? The answer is no. You want to tighten the vagina on its own, not assisted, and you want to tighten it over time. It's not a hurry thing; it's a lifetime thing. And yes, the answer is no. Just use the natural way. Do your kegels without balls.
What are those?
They are put in the vagina to you squeeze against them.
Okay. I didn't know that.
That's it.
Yeah, I think so far that's it.
Good. We can say good night.
Yeah.
Okay. Good night, everybody. Go to the doctor and do not treat yourself over the counter. Please go to the doctor and have the urine properly treated. Don't make jokes with it. Yes. Yeast infection is the same as fungal infection. It goes by many names. It's called yeast, it is called thrush, it is called candida, and it is called fungal. They are all one and the same thing. So you will hear us use different names: fungal infection, candida, yeast, like that. That was the question. Was, is yeast infection the same as fungal infection? And yes, it is. Okay, I think we say bye bye.
Okay, you're going to give people 2 minutes.
There's no more. Amoyo, I missed you. She's not there. She's here. Okay, so bye bye, everybody. We will meet next week. We shall tell you what we shall be talking about. But we would appreciate getting suggestions of what you want to hear. Sometimes I just imagine what you want to hear. But many a time I answer things that I find people asking many times over and over. So thank you very much. Enjoy yourselves. Enjoy your weekend. Keep safe. I don't want to miss any of you on this forum. Good night.
Good night.
That's it.